Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley, and today I wanted to talk to you about toe fungus, foot fungus, athlete's foot, or consistent smelly feet. If you suffer from this, I know it can be an embarrassing thing at some times when you're at the beach. When you're outside, it's more flip-flop, sandal weather. And it may be that the nails are a different shape or there's too much toe fungus growing on certain toes. So I wanted to discuss in this podcast how it is more of an internal environment issue than just a topical skin problem. So I want to talk about in this podcast how the infectious states of mold, candida, and parasites can lead to the formation of a plaquing called biofilm. And biofilm can actually get into certain organs or places in the body, and that can cause the formation of inflammation in those particular areas. This biofilm and goo can act like a plaster that protects the infections from your immune system. They literally hide behind it. So the biofilm can lead to toe fungus, athlete's foot. And with this, the higher amounts of fungus and parasites can damage or impair the function of the liver. And the liver in Chinese medicine controls the nails. The nails are made of sulfur compounds, like cysteine component compounds. Now, if the liver is injured or impaired, it cannot help the body make the nails. That's why Chinese medicine says the nails are controlled by the liver. So if you have infectious plaquing or goo in the body, plus impairment to the liver, it could injure the formation of the nails. So your nails can be a representation of what's going on internally. We also want to discuss with the biofilm and the liver herbs that help cleanse the infections and the biofilms and help with the liver repair. Those I have here at the office. I use Scutellaria Supreme, which is Chinese skullcap, which is so good at cleansing out yeast, mold, and fungus. I even use it on children with the Scutellaria tincture. It is amazing for chronic candida or foot fungus problems. It will clean out fungus in a very effective way. I also like Malia Supreme. Malia Supreme is neem. And neem is an Ayurvedic herb that will clean yeast, mold, bacteria, viruses, fungus, and parasites. And the Malia is so good because it's so broad spectrum. I see that it actually helps cleanse out the infections. It can help the liver and help your blood sugar balance. And the third herb we can discuss is Japanese knotweed. And Japanese knotweed is so good at cleansing out Lyme infections, plus Epstein-Barr virus. And it has been known to have great action against biofilms. So these are my top three. There's many more. Go to supremenutritionproducts.com and they can give you really good insight and research about the other herbs that help with similar issues. But for me, these are the top that I use. I also use topical tea tree oil. I think it's great to use topical alongside the internal cleansers. Now, write this down as well. Biofilm busters. Allergy Research Group has biofilm neutralizer. There is US enzymes, and they have nattokinase and serrapeptase or Serazyme. If you look at US enzymes, you look at the neutralizer product by Allergy Research Group, and there's also Interface, INTERFASE, by Claire Labs, KLAIRE. Claire Labs makes Interface. And there's also a biofilm defense by Kirkman. The reason I want to tell you this is because you can write these down and start researching these. And these are biofilm disruptors. They're enzymes that go in and break apart this biofilm, this goo, this plaquing that the microbes give off so that they don't have a place to hide. So we're going to talk about the biofilm disrupting. And I also want to talk about how we can use different light therapies, or how you can use it to help along with the herbs and with the biofilm neutralizing. I just bought an Avant laser. Now, this is not the only thing you can buy, but it has frequencies with red light and violet light to go in and kill off the infections, literally disrupt or disconnect the frequencies of the infections that attach to your skin, because they create a magnetic electrical bond with your tissue. And you need wavelengths to go in to break that bond apart. The violet light, like ultraviolet, has been used to kill off infections in many settings by using pulse pattern light sources. And this is what this does. It's a class 3 laser. I'm not saying that's the only thing you can use, but I want you to know that you can use those to get into those deep, dark areas. Because when you're talking about caverns, sinuses, crevices, we're talking about those deep, dark areas of the body. Infections like to get in there, create the biofilm, and hide out. Places where the immune system does not want to go. So when you start to use light sources like infrared, red light therapy, the wavelength, the pattern of the light, goes deep into the skin, triggers the receptor sites, the sensor receptors in your body to help initiate changes internally. That's how red light works. It hits the receptor sites, photoreceptors in the skin, on the organs, and those photoreceptors receive the light source and they get information from the light, and it helps the body to give it energy to go do a job, clean out infections, remove infections, detoxify. That's how sensitive our bodies are. It's amazing that we have sensors in our skin, on our tissue, in our organs. We are made of many light reflectors. The crystals that make up a lot of our body are light reflectors. So this is so interesting to me about frequency medicine, but I can get into that. But let's stick with the toe fungus. So let's talk about some different therapies you can use. And we're also going to talk about how the accumulation of the foot fungus gives us the telltale signs of smelly feet, smelly armpits. Actually, the scalp that's itchy and has dandruff and a different smell. I've had people say their scalp smells. So you not only have the toe fungus, but if you have that and you notice that you have consistently smelly feet or the scalp issues, this is telling you that the infection biofilm could be really heavy within the digestive tract. But it means that the infection could be pretty much widespread. So that's why utilizing these herbs and this therapy is going to help you with cleansing the toenail fungus. So first of all, let's just go a little deeper. We talked about how it's connected to the internal environment. So if we have any type of yeast, mold, or bacteria, you have to think about your body, your internal environment, just like a shower curtain. Have you ever seen a shower curtain that's in the dark and doesn't get wiped down and you don't bleach it? Mold grows on there. So if you have organic material, you can have mold grow on it. If there's moisture and there's organic material for the mold to eat off of, that moisture allows the mold to spread and allows it to eat more of the wood or the shower curtain or any organic material. And it starts to grow and multiply. Spores begin to split apart and become new spores. Have you seen the mold behind the drywall? Because moisture got behind there and wood's an organic material. So think about how your body has organic material on the inside. And your body, your lungs, let's say your colon, your gallbladder, are all organic material. And when mold or fungus and even parasites get into those areas, certain species have been known to munch on the proteins in your body, munch off the sugars that you've ingested, eat the amino acids you just took in. And yes, some of the bacteria, parasites, and fungus can actually eat off your own tissue. So, a damp, dark environment internally, according to Chinese medicine, makes it a perfect breeding ground for fungus and mold and the parasites. They multiply. So, if you have a diet that was ever high in carbs, starches, sugars, refined sugars, trans fats, corn flour, corn syrup, any bad fats in the body, then you'll start to see that the infections eat off of those things and produce byproducts. So they produce neurotoxins, body toxins, which gives you brain fog and makes you feel slow. Now, as they grow, they want to stay protected. So not only do they create these neurotoxins, what they do create internally is biofilm. And biofilm is like plaque on your teeth. Your teeth has bacteria, good and not so good. And if you feed the bacteria too much of the bad stuff, they'll overgrow. And to keep themselves thriving, they'll create plaque. The infections, the microbes take proteins, sugars, fatty acids, and even calcium alginate. They'll actually take minerals out of your diet, and some say even leach it from your bones and utilize that to make its own plaster. It mixes it up, and it puts a plaster in the area where it's alive, whether it be in the bones, whether it be in the lungs, the sinuses of the head, the ears, whether it's in the tonsils, tonsil stones, whether it's in the esophagus or in the digestive tract or in the bladder. They create film, plaquing. And then to survive, they get behind it so that your immune system doesn't go in and grab them. Here's the other kicker. With the biofilm, if you have an infection that spreads and they spread to different parts of the body, then you can have different sets of biofilms made of infections that are communicating with each other, like a telephone call. So it's been even shown like the coral reefs of the oceans are like coral alginates, just like the alginates they use in your body. And there is a quorum that is a communication system that one coral reef can have with a coral reef in the same area, which is like maybe 15 miles away. They can communicate all the way down there, telling that other part of the coral reef that there is danger, that something's killed off the coral reef. And the coral reef will do what? It'll start making adjustments for its survival. It actually grow in certain areas. And that's what happens internally to your body. So you can have a biofilm up in the sinuses, and that same infection could be somewhere in the digestion area down below, and there could be a communication that somebody is using a nose spray that has herbs that kills off the biofilm. And there's a signal that tells the other part, hey, there's something else going on down here, and I need to defend myself. So they're going to actually go into high gear. Infections are going to take more sugars, more alginates, more proteins and fats. So the host, us, gets hungrier. Man, I'm craving sugar. I'm craving fats. I'm craving, why am I having cravings for different types of proteins? Because there's a quorum. And this communication has been shown to trick your nervous system into being hungry for what they crave. Check out the book, Your Brain on Parasites. It is fascinating about what parasites can do to your neurology and into your patterns of mood and behavior. Check out that book. Now, one of the things I would say is as we start to clean out the biofilms, they start to communicate with each other. The thickness of the biofilm can determine how thick your toenails are and how smelly your feet are or how much foot fungus you have. That is very stubborn. If you think about plaquing and biofilm, if it gets thick and hardened, it could literally take lots of enzyme action or much herbal action to help break apart thick biofilm. That's why when you have bowel movements that have lots of mucus and foam, those are all biofilms. You're knocking them loose. So you have this communication, you have the thickness of the actual biofilm, and now we want to talk about if we break them apart, it's a good thing, but we have to realize that wherever this biofilm's at, it could allow the infections that are underneath the surface to come out. So if you break apart the biofilm too quickly, it can make a Herx reaction or a detox reaction. So I want you guys to make sure that you do a biofilm detox in a very gentle, slow manner as possible. If you take a biofilm buster that we mentioned, then if you start to detox too quickly, then hold back. Don't do one every day on empty stomach. Do one every other day on empty stomach. In fact, when we talk about the biofilm neutralizer, I tell patients, let's do one biofilm buster or biofilm product and do that once a day on empty stomach and see how you feel after a week. If you start to feel really nauseous and really sick, then I say go to every other day. Soon the biofilm will start to degrade so much you'll see more mucus in your bowel movements. You'll have more drainage from your nose because the mucus in your brain is going to actually detoxify. And you may have more smelly armpits and feet, but that's a good step because you're cleansing. During this time, we're going to talk about the herbs that can help cleanse out the infections as we break open the biofilm. But during this time, it's really important to consider coffee enemas or colonics. Coffee enemas can go into the colon and use the coffee as an astringent to pull out all the mucus and all the plaquing in the gut, and this will allow your gut to signal to the rest of your body that it's okay to detoxify. When the colon cleanses from a coffee enema, you start to get the plaquing, the biofilm out. It will also help your bladder detoxify, and it signals to the lungs, to the sinuses, that it's okay to drain down through the lymph system into the liver because the liver is starting to get cleaned out with the colon. So you had the biofilms that are basically building up. When we see that we break up with the biofilms, we want to use coffee enemas or colonics. That's just a suggestion. I do think saunas are good, but I love infrared saunas and using those frequency wavelengths to help detoxify the body. But we have to make sure you have proper bowel movements as you get rid of the biofilm. You have to. So if you start to flush them out, you can do saunas, but I'd say drink plenty of water. I would use hydrogen water. Hydrogen water is very good at producing energy in the body to actually allow the body to pull out the biofilm. So hydrogen water, infrared therapy, coffee enemas while taking the biofilm neutralizer. So remember, if the biofilm is stuck around the feet, if there's biofilm up in the digestive tract, if it's around the armpits, those are the areas that are going to have the most smell. And it's also going to be the area where you're going to have the toenail issue because that biofilm is in that area and there is heavy amounts of fungal overgrowth. And what happens with fungus in certain realms and certain areas of study, they say that a lot of the fungus and mold will go into the toenails and they eat up the toenail. That's why they get loose. They eat the dermal layers. They eat all the proteins within the areas around the toes so that your nail can't stick. So your body is busy trying to grow new tissue, and that's why it gets thicker and thicker. Your body is damaging so much, it is trying to grow new tissue to actually help you with formation of new nails, but the fungus is so much, it's just eating it away. That's just one aspect of toenail fungus. But when you have biofilms in those areas, it's crucial to keep the pathways of detox open, so as you start to flush the biofilm and the toxicity of the fungus, you're going to start seeing that the nails could fall off, but they'll grow back new. I'm thankful I've seen patients do this. Not just my patients. I've seen other practitioners who have great practices talk about how they used tea tree oil, internal biofilm busters, internal herbs, cleanse the liver, cleanse the biofilm, cleanse the gut, and the foot fungus went away. So you use the coffee enemas. We want to cleanse out the liver. Now, the ones I just mentioned, Scutellaria, Malea, and the Japanese knotweed are great for liver cleansing. Most people look into milk thistle. I like it, but I love Schisandra as well. So Schisandra Supreme. I'll put a link for all the Supreme Nutrition products in the show notes. But this, with Schisandra Supreme, and these are just a few examples, can go in and kill off a lot of the yeast and mold and parasites. So I want you to make sure that you realize it's not just a fungal yeast issue. It can be parasites as well. Parasites will work in quorum with the mold and the fungus to actually create this goo. They will actually create communities like these little housing areas, these little suburbs, these basically these communities of microbes that are in quorum like the sea corals, and they're communicating with each other. So they benefit by eating off your tissue, eating off of your proteins and sugar. So they work together. So when we take the herbs, we're trying to use a shotgun effect. So please remember, if you take an herb, you don't want to take an herb repeatedly for a year. The infections know when you take a certain herbal, they know what's coming up. They go, okay, he's taking that same thing again. Let's go hide. Let's go into another biofilm. That's why you use the biofilm plus the coffee element to break them up. But then we start using the herbs at the same time, and then we start to see that they are not used to these herbs. And all of a sudden, these herbs at a shotgun effect. We use Scutellaria 1 week or 2 weeks, and then we shoot over to Malia, and then we add some Japanese knotweed, and they cannot keep up and try to morph to escape your herbal shotgun effect. Study the herbs, utilize them. I know that many of us have pharmacies in our houses. I get it. I have a whole closet full of them, pantry. But the thing is, I utilize them. I do self-muscle testing, but I do read and I say, okay, I'm going to do this for this many weeks, and then I'll do this for the next 2 weeks. That's why I always love to have a holistic practitioner that you can do a virtual consult with, or somebody, a doctor, or somebody who's a holistic practitioner in your area to help guide you if need be. So the shotgun effect, to cleanse and to get the liver cleansed. So I use Schisandra plus these to start getting rid of the gunk in the liver. Another good one, if you've ever had kidney stones, liver stones, gallbladder stones, is Bodyguard Supreme. That can get rid of stones. So if you're going to say what is really good for the liver, I like Schisandra and I like Bodyguard as an extra oomph to the liver. So you start cleansing out the liver. We start utilizing light therapy. You don't have to get the Avant laser, but you can use a red light therapy source like Mito Red Light, or BioLight. And there's different light panels. And check if they're in the ranges of 620 to 650 nanometers, nm. If they are, they will have an energizing effect on your cells. And if you put energy into the cells, you will detoxify. 620 to 650. So we covered the herbs, we covered the biofilm neutralizer, the coffee enemas, and you can use infrared sauna. And I also am a really big proponent of just making sure you use those coffee enemas. Keep the colon clean. Now, with the liver, as it gets damaged, it can damage also the formation of the nails. So any junk or biofilm or any toxicities in the liver can disrupt the formation of the nails as well. So you can't utilize cysteine, the amino acid that helps make your hair and your nails. And if that pathway is disrupted, you will have deformed or misshaped nails. So you have to clean the liver. So cleaning the liver with the biofilms and utilizing the right herbs sets it up where you probably have some nails that could fall off, but then you'll have new ones grow back. You'll know whenever the fungus starts to clean out is when your feet stop smelling so bad, when the scales of the feet stop falling off, when your scalp stops having dandruff. Will it take a long time? It could. Give yourself grace. I've seen these things take up from 8 to 12 months. I like to see results in 3 months. But some people have different bodies. And yes, I've seen it done very quickly. But remember, it has to do with how well your body detoxifies. When your liver is congested, causing the misshaped nails, it also means that there could be problems with your MTHFR gene, methylation. And that's a huge thing to check if you have toenail fungus, is MTHFR. Not everybody that has toenail fungus has MTHFR, but I want you to know that you can utilize this information to know that your liver is congested. So, we went through the steps. We know that there is parasites, and there's yeast, and there's fungus. Now, the last thing I want you to know is that in the show notes, I want you to look at parasites.org. I get no kickback from them. Maybe I should ask if I can get like a discount for my peeps and the people who are listening to the podcast. But parasites.org has a test not only for parasites, for roundworms and certain protozoa, but also for mold and fungal, like candida and certain funguses in your poop. And the reason it's important is because if it's in the digestive tract, that would give you clear indications you have to get rid of parasites and certain fungus. So I would get that test and check out if I had an enormous amount of fungus plus parasites. And to go a step further, you could go to Microgen DX. You hear me tout about it all the time. Microgen DX. D as in dog, X as in X-ray. And you can use their poop test to see if there's high amounts of candida or any type of fungus. They have lots of test mechanisms there. They test a ton of different types of infections. If you do find it, we have to do the steps we talked about. But at least it's in front of you, showing you this is what's happening on my internal environment. That's what's happening on the feet. Because you can put all the topical ointments you want on the feet, but if you don't clear the environment inside, it will just keep happening. It'll keep coming back. That's the labs I would suggest. So look into these lab reports, see if they resonate with you. Look into these supplements. I think they can really help you to get rid of your toenail fungus, help you with athlete's feet, and help you get rid of all those pesky symptoms. So guys, I hope this was an informative podcast. If you guys like this type of information, remember to shoot me some comments. Tell me if you liked for me to expound on this. I do have a membership that I do go a little deeper with information concerning this. And when I mean deeper is what are some specific protocols that I would put together for them, for the person who has this issue? And do we need to go any steps further to look for any co-infections along with this that could be telling me there is problems with toenail fungus? And I always try to correlate it with other symptomatology, telling you this could be associated with this other infection like Lyme. So those are the things we discuss in the membership. But overall, this is a great protocol. Guys, I hope this is informative. If you liked this episode, just like and subscribe. And from all of us here at the Ancient Health Podcast, I hope you guys have a blessed day. Thank you so much for listening. And until next time, God bless.